Hello again. Now, efforts to tighten up our drink drive testing are being welcomed by those sick of seeing drunk drivers walk away without charges. Police Minister Anne Tolley's ordered police to come up with a test ensuring offenders can't use loopholes to escape prosecution. Well, the clinical director of Waikato Hospital's emergency department has been campaigning for a change like this for 5 years and is with me now. John Bonning, good morning. Thanks very much for joining us on this. Let's just clarify the issue here, because I thought it was simple. You get done for drink driving, you go to hospital to get a blood test, then you go to court and you pay the consequences. But you're saying it's far from that simple.
Well, it appears not, no. I mean, only people who are injured in the process of drink driving that come to hospital. Others are processed in the police station, where I understand it takes up to 40 to 45 minutes with police off the road if they're in the police station to process. And in hospital, when we've got the care of all the sick and injured other people in the department, it takes us up to 20 minutes to process these people just to do the blood alcohol samples.
And during this process, as you say, for you within the hospital and for the police within the police station, there are a number of protocols and steps you have to go through, and at each step in protocol it gives potentially a lawyer an opportunity to pick up where something might have been done wrong.
Absolutely. The paperwork is very, very long and cumbersome. 12 sub-clauses requiring the signature of the blood taker 17 times and 4 copies. There's carbon paper. It is really, really so cumbersome, and there's so many areas in there that are flawed and are fertile for being contested in court.
And of course you've got clever lawyers who are making a living out of being able to pick up on this sort of a thing.
Well, I don't blame the lawyers, I blame the law. The statutes have to change, and I've always said that there's an equivalent system for processing drink drivers in hospitals in Australia that is manifestly simpler paperwork, safer receptacles to put the blood into. The whole process takes a lot less time and that does not require police presence. Did you realise that a police officer has to come and witness the blood sample being taken in hospital, taking them off the road and off the beat, to wait around often for a while whilst we're busy dealing with other patients, and then when we can take the blood sample? It's just such a waste of resource and a waste of time.
John, the Police Minister seems now on board with this. Is she taking the right approach? Is she listening to what you're saying?
Well, I believe so. By all means, take a Greenfields approach. We're told that the Australians have a different legislative framework to us, which of course I don't know any different to that. But I believe that a system that works properly and works well is present across the Tasman, and I would be extremely grateful if they could look very, very closely at that system and see how applicable it is to the New Zealand setting.
Is there any good news here, John? I mean, are you seeing a fall in the numbers coming through the emergency department as a result of drink driving?
Well, I was reminded when I spoke about this issue to a nursing conference on Friday that we've come a long way in 20 years, but it does seem that we've stagnated a wee bit. And when you look at the benefits and the improvements that have been made in places like Victoria in Australia, their population 5.5 million, their deaths and injuries through drink driving are manifestly less than us. And it was shown that simplifying the process and lowering the limit helped with that. So, we have made progress, but I think we can make more.
There's also the issue you were referring to, how you were saying how the way they actually do the blood test is a great deal safer. You feel that there's a safety risk to your staff as well in the way you're required legislatively to take the blood.
Absolutely. I mean, if I can just briefly show this vial here is what we need to squirt the blood into, and these are vacutainers, which goes in much more safely. Blood can splash out of these, and we haven't used this sort of system in blood taking in hospitals for 20 years. It's manifestly unsafe and putting health practitioners at risk.
Okay, thank you very much for that, John Bonning from Waikato.